Something is wrong with you. Badly wrong. No hospital. No doctor. No medicine cabinet. No painkillers. No antibiotics. No way to know what is happening inside your body. What do? Ancient humans figured this out, and some of what they discovered still works today. Actually works. Scientifically confirmed. In laboratories. This is the story of how humans discovered medicine, without any of the tools we associate with medicine. And the answer will change how you think about both ancient humans and modern medicine. First, where did the very first medical knowledge come from? The answer starts not with humans, but with animals. Chimpanzees in Tanzania have been observed doing something extraordinary. When sick, they seek out specific plants. Plants they never eat when healthy. Aspilia leaves. Bitter. Unpleasant. Nutritionally worthless. But used specifically when sick. Scientists analyze these leaves. They contain compounds that kill parasites. The chimpanzee was self-medicating, with a plant that actually worked. Elephants eat specific clay when pregnant. The clay provides minerals they need. Bears eat certain roots before hibernation. The roots treat intestinal parasites. The animal kingdom has been doing pharmacology for millions of years. Ancient humans, who shared 98% of their DNA with chimpanzees, almost certainly inherited this knowledge. And then they did something animals cannot do. They shared it, taught it, built on it. Now, what is the oldest archaeological evidence of plant medicine? A Neanderthal burial site in Shanidar cave, Iraq, 60,000 years ago. Pollen found around the burial. From 8 different medicinal plant species. Ephedra, groundsel, grape hyacinth, all known medicinal plants. Ephedra is still used in modern medicine today, 60,000 years later. Even Neanderthals, not Homo sapiens, had plant medicine knowledge. Medicine is older than our species. Think about that. Now, how did ancient humans actually figure out which plants worked? Through the most expensive research program in history. Trial and error. On themselves. Someone ate a plant. Something happened. They remembered. They told someone. That person told someone. Across generations. For thousands of years. This is not guesswork. This is empirical research without the laboratory. Over thousands of years, ancient humans became extraordinary pharmacologists. Now, let us look at specific ancient discoveries that modern science has confirmed. Willow bark. Used by ancient humans across multiple cultures for pain and fever. Ancient Egyptians documented it 3,500 years ago. Ancient Greeks used it. Indigenous Americans used it. Willow bark contains salicin. Salicin is what aspirin is made from. Aspirin, the most widely used drug in the world. Discovered by ancient humans. Thousands of years ago. Turmeric. Used in ancient India for over 4,000 years as an anti-inflammatory. Modern research has confirmed curcumin, the active compound in turmeric, has genuine anti-inflammatory properties. Garlic. Ancient Egyptians gave it to pyramid workers. For strength. For health. Garlic contains allicin, a genuine antimicrobial compound. The ancient Egyptians were right. Honey. Used as a wound dressing in ancient Egypt and ancient India. Modern medicine uses honey in wound care today. It is genuinely antibacterial. Opium poppy. Used as pain relief in ancient Mesopotamia 5,000 years ago. The active compounds in opium, morphine and codeine, are still the most powerful pain relievers we have. Ancient humans were not guessing. They were discovering. Systematically. Over generations. Now, what about surgery? Did ancient humans perform surgery? Yes. And this one will genuinely disturb you. Trepanation. The oldest known surgical procedure in human history. Drilling a hole in the skull, while the patient was alive. Found on skulls dating back 7,000 years. Across Europe, Africa, Asia, and the Americas. And here is the part that will change your view of ancient humans forever. Many of these skulls show bone regrowth around the hole. The patients survived. Some survived for decades after the operation. One skull shows 3 separate procedures. Ancient humans performed brain surgery. Successfully. 7,000 years ago. With stone tools. With no anesthesia beyond plant sedatives. With no concept of infection. Why did they do it? Probably for seizures. Severe headaches. Mental illness. Head injuries. They did not know why it worked when it worked. But they noticed that sometimes it did. Now, the most remarkable ancient medical discovery of all. In 2021, archaeologists in Indonesia found something extraordinary. A 31,000-year-old skeleton. With a missing left leg. Not broken off. Not missing. Surgically removed. The bone shows clean-cut marks. And the person survived the amputation. By years. Possibly decades. 31,000 years ago, someone performed a successful surgical amputation. In the Stone Age, in a jungle, without sterile equipment, without blood transfusions, without antibiotics. This pushes the known history of surgery back by 24,000 years, and it raises a question nobody has answered yet. How did they control the infection? They must have used something. Antiseptic plants, specific clays, something we have not identified yet. Ancient humans were doing things we still cannot fully explain. That should humble every one of us. Now, who is the healer in ancient human groups? Almost certainly a specialist. Someone who dedicated their life to this knowledge. The same person who was often the shaman. Medicine and spirituality were not separate. Healing the body and healing the spirit were the same act, performed by the same person. And crucially, the healer was protected by the community, cared for, supported, because losing the healer meant losing the knowledge. The knowledge lived in one person. This is why healer knowledge was passed so carefully, from teacher to apprentice, generation to generation. Now, what does this tell us about ancient humans? They were not primitive. They were not stumbling blindly through illness. They were systematic observers, careful experimenters, dedicated teachers. They were doing science, without laboratories, without instruments, without the word science. And much of what they discovered, we are still using today. Aspirin from willow bark, morphine from opium, digoxin for heart disease from foxglove. Around 25% of all modern pharmaceutical drugs are derived from plants. Plants first identified as medicinal by ancient humans, often thousands of years ago. The next time you take a painkiller, you are using knowledge someone figured out without a laboratory, without a university, without a research grant, without even knowing what a molecule was. Just a person, in pain, in a world full of plants, paying attention, and passing that discovery forward, to someone who passed it forward again, all the way to you, right now, taking medicine that began with that first careful observation. If this made you see ancient humans as the brilliant scientists they actually were, that is exactly what this channel is here for.